The EOS system is a revolutionary imaging technology that scans the entire body from head to toe with a low dose of radiation. EOS exams are fast and comfortable, captured in an open-air cabin that aims to improve the patient imaging experience. EOS Advanced Orthopedic Solutions offer an entirely new frontier of 3D information for making clinical decisions and engaging patients, including EOS apps, patient-specific surgical planning solutions for spine, hip, and knee conditions. The complete offering from EOS Imaging provides differentiating technology that can improve patient care.
University Orthopedics made the decision to buy EOS because this is just a crucial part of our ability to care for patients. In the world of pediatric orthopedics, we've known about EOS for a long time, and it's been revolutionary in the way we've evaluated spinal deformity and the effects of our treatment. But when trying to see how this would be useful for a large subspecialty orthopedic group, it takes a little bit of looking into. And what we found is that the applications for EOS aren't just limited to pediatric spinal deformity. In the adult spinal deformity world, we know that often patients have arthritis of their hips and their knees, and that affects how they stand. So the x-ray that you get of a patient's spine standing up may only give you part of the story if you don't have the ability to scan their whole body. And we've seen our spine surgeons actually change how they approach the surgical management of those patients and get much better results. And then it goes into the world of adult reconstruction. You know, the ability to get a long leg film to really look at how the patient's leg is lined up, to see if there's a difference in the length of the leg, and to be able to evaluate that in 3 dimensions, and also even template their surgery, simulate their surgery before they do it, is all through the use of a very quickly obtained low radiation scan has been revolutionary. So if we look along the spectrum of orthopedics, the ability to get weight bearing, standing up, full body x-rays in the position that our patients walk and run and play, and plan our treatment in that mode has been absolutely groundbreaking. And it took a little bit of convincing, but I think once our partners were able to see the benefits to their practice, it was an easy sell. The great thing that we've seen with the EOS is the amount of patient interest. The patients like how quick the scan is, they walk in, they walk out, and they're really excited when we show them their images and their 3-dimensional reconstructions of their spine. It really is better for patients, and they know that. Don't be shocked initially by the sticker price. Clearly, it's expensive technology related to a simple plain x-ray, but it's better than a simple plain x-ray. And the improvement in your practice in terms of efficiency, of safety to your patients in terms of radiation, the ability to truly monitor what you think you're doing and make sure you're actually doing it post-operatively with x-rays really is going to make your practice better, it's going to be better for patients, and ultimately the price that you pay for the machine is a small fraction of what the value you're paying.
Initially, the pediatric orthopedists were very interested in the EOS machine because of the low-dose radiology and what they could do for their scoliosis patients. That grew into the adult spine surgeons. They were interested in it for their deformity patients. And it quickly spread to the adult reconstruction surgeons who saw benefit in it for their more difficult joints. So the reimbursement on the EOS is, it's difficult when you try to compare it to a regular x-ray machine. The reality is you can bill multiple CPT codes or multiple studies for each patient that you do. And if you do that, the numbers do work in that the machine pays for itself and its costs. The thing that's difficult to measure is the amount of extra cases that you end up bringing in by being able to offer the service. The response has been phenomenal. The doctors love the images that they get from that machine. It is totally booked 100%.
EOS is a very powerful tool in that it provides the best quality x-rays that we can get, and it's able to do so with the lowest possible radiation, so it's very safe for patients. In doing so, you can create 3D models of the spine to better understand the patient's spinal alignment and plan surgery. The 3D models from EOS are extremely useful because you get a better idea of the patient's overall spinal alignment and also the exact nature of their deformity. There's rotational components to a spinal deformity, things called kyphosis and scoliosis, and it really helps to give the patient an idea of the nature of their deformity. So I've used imaging tools and 3D planning software for a number of years, but this one really is higher quality and is seamless, it's quick. There's actually service provided by EOS where they'll perform the measurements for you, and it essentially allows the surgeon to end up manipulating the amount of correction that we're planning on getting to the spine. And so it really is generally a quicker, easier, and from what I've found, better tool. Before we had EOS, I didn't know what we were missing. It's amazing how much information you can get on how patients are compensating for their deformity usually through their knees and hips, and it's really allowed me to better understand my patient's deformity. It allows you to provide better care for the patients, and so if the practice is capable of making that investment, it's well worth it.
Imagine the management team, we're not on the clinical side, so we're not even cognizant of these type of technologies, so the physicians would bring proposals to us, and then we'd collaborate with, say, EOS in this instance, where we learn a little bit more about the cost benefits of the technology. Being that it's an advanced imaging technology, it's more expensive than, say, a traditional DR, but there still are added benefits to utilizing this technology, and so we have to understand those benefits and basically do fiscal forecasting to see if we can make it work. What was important to us was to understand from the clinicians, what else you could do, really why it was better. We understand that it's lower radiation, and so that's advantageous to the patient. But are there other advantages too? And so what we found was it's faster. So think it's more efficient. We could do more scans. Patients are happier. You could do a full scan in 3 minutes that might take you 12 minutes with a traditional X-ray machine. And so think from a reimbursement standpoint, you could do more codes in less time. From a patient advocacy standpoint, it's they love it. It's less radiation. It's faster. The images are great, so the physicians love it. So we've been happy to utilize it. We want to be the premier provider in our region, and we want to give patients the best service. And so we discern that this is the best option, for diagnosis for a lot of ortho musculoskeletal ailments. It's a multifaceted decision, and we decided it was important to us to give this solution to our patients.